My name is Francis Ochen from the African Society for Laboratory Medicine, and I am going to be your moderator today. For those that I haven't met either virtually or physically, Happy New Year and compliments of 2024. As usual, our session will run for 1 hour. We will take one presentation and then get into the questions and answers. Kindly join the discussions through the chat. That is your first priority opportunity to join. We do have language interpretation services, so please keep to one of the 3 channels, either English, French, or Portuguese, depending on the language of your choice. And at this point, I will also ask our presenter to go a bit slow so that our interpreters are able to do effective interpretation in real time. Today, we're looking at human resource and human resources for health. And that really is us who are part of the system that is delivering the services that we are supposed to deliver. And we know that human resource is not only the most important, but the real asset of any organization. And for sure, health systems can only function when there are health workers. In today's era, we also know that success of any organization will hugely depend on the careful selection, deployment, and management of the organization's workforce. And of course, no operations is successful without getting the best people in the right position so that then they can deliver on the goals and aspirations of any organization. There are global instruments that actually work towards supporting the development, deployment, and appropriate utilization of human resource. And this includes, among others, the Global Strategy on Human Resource for Health, which was launched in the 69th World Health Assembly in 2016. And it desires really to have universal availability, accessibility, and coverage of quality health workforce that supports effective health service delivery. And so in today's session, we look at what the lab workforce of the 21st century should look like in the era of epidemiological disease transition, One Health, technological advances, globalization, and pandemics or epidemics in the different parts of the world. And so to take us through this, we have our speaker, Dr. Suzanne Kiwanuka. And Dr. Suzanne is a senior lecturer in the Health Policy and Planning and Management Department at the Makerere University School of Public Health. Suzanne has worked on maternal and newborn health, human resources for health, governance and knowledge translation at national and international levels. She did a postdoctoral research on private sector knowledge management and is currently working on family planning to pick out such results that can be scalable. And she is also part of the team that is assessing the COVID-19 pandemic's response and outcomes across multiple countries to generate lessons for systems strengthening to support the global response should we get the next pandemic or epidemic. So at this point, colleagues, join me in welcoming Dr. Suzanne Kiwanuka to take us through the presentation, and thereafter we'll get into the questions and answers. Dr. Suzanne, let me hand it over to you.
Thank you very much, Francis, and thank you very much for giving me the opportunity, I would call it the privilege, to actually present to this esteemed platform. I have a passion for human resources. I have done work on human resources over the past more than 20 years. And I've also done some work in the laboratory workforce. So I'm going to be presenting to you, and I look forward to an exciting interaction and perhaps insights from you, because you're really the workforce. So I'll get into it and we will have a discussion afterwards. So my presentation is a presentation I made at the last ASLM in Cape Town. So pardon me if you've already listened to this. I'm going to talk about mostly the same stuff. So I'm going to talk about laboratory professionals for the 21st century. How do we build a workforce fit for purpose? Basically, laboratory professions, as you know, are the backbone of quality diagnostics. But beyond diagnostics, they monitor care, they monitor, how the patients are responding throughout the treatment. So they offer both medical individual services, but they also offer public health services at population level because of the work they do. I don't need to tell you. Some of the challenges with this particular workforce is the lack of appreciation of how broad this laboratory workforce is, because it's not just a medical workforce, but it has the imaging, it goes beyond the workforce. And this is another of the reasons why the laboratory profession has been mostly the neglected cadre within the health systems. Like I said, the laboratory workforce tends to work behind the scenes, while the doctors, the nurses, the midwives, they are on center stage. So this workforce is the workforce in the kitchen, so to say, while the waiters are the ones bringing the food and serving it. So there is a workforce behind the scenes, and this happens to be the laboratory workforce, which is responsible for what we are seeing at the front line, the care that is being given by the doctors, by the nurses, by the midwives. They do a lot of work behind the scenes, and they tend to be neglected. But the laboratory workforce is also under-researched. If you went online to try and look for research on the workforce, you will find very little information about this laboratory workforce. For instance, how broad is it? Who is where? What are the shortages? What are their work experiences, their motivation, their mental health? So it is under-researched. The laboratory workforce is also characterized, like all other health workers, insufficient numbers, skewed distribution, the level of qualifications you cannot quantify yet. What do you need vis-a-vis what you have? But they also have a limited career opportunity because of the restricted market within this particular workforce. When it comes to the highly specialized staff, you will find a constrained supply. And by specialized, I am talking about people who are able to do specialized imaging and more high level of diagnostics. So this is mostly driven as well by the sluggish public sector demand, because the public sector has restricted numbers it can take, and then you have the low wages. Then you also have turnover of staff, especially those who are highly skilled. You also have a predominantly male workforce. And so the potential for gender barriers to advancement cannot be overlooked. So you look at the environment within which this workforce works, and this is the same environment where doctors and nurses are operating. Now, for the laboratory workforce, there are very clear key performance indicators. You have to do this number of tests. So it's a very structured way of working with very clear outputs, meaning that the performance has to be seen. Okay, I tend to think of the laboratory system as a system within another system, but it has been neglected because we tend to look at the health system and we don't look at the laboratory system specifically. For instance, if you look at financing, for instance, there is a major emphasis on health financing because it's an independent building block of the health system. But when it comes to the laboratory, they have a particular set of procurement, commissioning, decommissioning. So there is a workforce needed to make everything work, and that has been kind of overlooked because the laboratory has its own entire system, and that has implied that funding towards the laboratories has tended to be low because it hasn't been viewed as another intricate, complete system within the system. Moreover, even where there is funding, there has been skewed funding for the laboratory, mostly going towards HIV, TB, malaria, all of them accompanying capacity building and so on and so forth. So this has been a challenge for the laboratory sector. also ultimately affecting the workforce. But times are changing. I could say a lot has changed already. I won't go into the demographic or epidemiologic transitions. We are now seeing a change in life expectancy, meaning that the disease profiles of the past 4 or 5 decades have changed. Now you're seeing young people getting cardiovascular diseases. You're seeing emerging and re-emerging disease threats. You're seeing climate change. You're seeing environmental threats, meaning that beyond the clinical, the laboratory workforce needs to have a major emphasis on environmental health, on occupational health, but beyond that, they also have to look at geo-health laboratories. What is happening geographically and how can that threaten the health system? On top of that, we have had changing service delivery models. These were initiated like maybe decades ago, but over time, there's been an acceleration. I'm talking about telemedicine. I'm talking about the use of laboratory networks, the use of community health systems, and the way they affect service delivery model, and how that ultimately impacts the laboratory. So changing service delivery models require another rethinking of the workforce. What do we need to do? Technologies. We have point of care, we have genomics coming in, we have automated systems, all of which affect the way we plan for the workforce, manage the workforce, or even develop. And also on top of that, you have the movement from paper to electronic systems, okay? Also impacting on, the way digital labs work and how they affect the workflow within the laboratories. In Africa, we have a saying that when the drummers change their beats, the dancers must also change their steps. You can't remain the same if the environment around you is changing. So you have to actually think ahead and see what you have to do. For the laboratory workforce, this requires knowing how we need to change in order to meet the challenges of the next decade. So how do we do that? How do we make a laboratory workforce which is fit for purpose, not just doing business as usual? I thought we could go over again the intended purpose of the workforce. This is a workforce which needs to be very well skilled in infectious diseases, surveillance, antimicrobial resistance, imaging, gene therapy, and a whole plethora of skills. Not everyone, but we need to know who do we need where and how many of whom do we need, okay? For our planet, for our continent, who do we need where? Not everyone needs to train in gene therapy, but who do we need? How many do we need to be trained in surveillance? How many do we need for particular sets of skills? And since we are also thinking of planetary health, we can't afford to think of health without thinking of occupational health, without thinking of veterinary health, environmental, food. I gave an example some time back during the ASLM that when food laboratories are not working, the consequences of that will be seen in the health sector, sometimes even faster. So if you have food which is poisoned, we have an industrialization of most of our economies. So we have lots of manufacturers. They are manufacturing sugar drinks, they are manufacturing foods there. And if the food laboratories are not working, you're going to see the consequences of that in the health sector. And you're going to be required to diagnose things you don't know why you're diagnosing, increase in liver cancers, increase in conditions which could actually be avoided if there was a holistic thinking of laboratories. So since the medical health laboratories are intricately linked with these other systems, it's important to know what we need and not neglect the veterinary, the environment, the food, the climate, the occupational, because the workload will ultimately come at the health laboratories. The other thing is the technology innovation. We have rapidly evolving technologies, and that means that continuously you need to train the workforce. It's not enough that they graduated. They need to keep abreast of the latest technologies. Then you have telemedicine. How do you marry the laboratory system to telemedicine? What are the models which could work? Okay. Automation. What does automation of laboratories mean for the workforce? Because in many cases, automation takes over a lot of workload. But what does that mean for the workforce? Some of you have heard of drones, drones for transporting samples. All this is technology. One of the researchers I've conducted actually exposed a gap in a very critical workforce need for the laboratories, and that is the engineers who need to commission equipment, to decommission it. And you might not look at these as laboratory stuff, but if the equipment is not working, if the equipment is available, if the equipment breaks down, it has an adverse effect on the work and the way you can do it. Then the new service delivery models, I covered that. You also need to look at labor market considerations. Many countries in Africa are actually negotiating cross-border employment opportunities, and that means that there needs to be quality assurance and accreditation, which can be uniform or perhaps almost standard across the board to enable this kind of smooth movement from, across borders and within countries. The other neglected thing about the laboratories is the leadership, the management, and the governance. For the most part, the laboratories have only evolved into strong leadership in the past, I would say, decade, where you can find that you have director forums, you have leaders coming together to kind of negotiate a way of doing this better. And of course, I wouldn't neglect to mention the new mindset for Africa. Africa is changing into a mindset of self-sufficiency for medical products. That means that we need a workforce which is able to police and also to deliver on this new mindset of self-sufficiency. So what exactly we need is a workforce with appropriate skill sets and who are performing. We need quality training, but we also need adequate numbers who are well distributed, but most of all, retained where they are needed most. So the framework for building the workforce mostly focuses on 3 areas. It focuses on the workforce planning. Who do we have? Where are they? What can they do? And what are the gaps? Who do we actually need? If we look at the entire framework, who do we actually need to meet our targets for the next decades or beyond? The other thing is the workforce development. When we have them, what are their training needs? We already have a workforce, but do those training needs, what training needs need to be addressed for the current agenda, which I have already discussed? And how can these needs be supplied by who? The third thing we need to look at is, for those whom we have, how can we use them efficiently? How can we use our workforce efficiently? How do we retain them? How can they network and learn from each other? Because we all know the value in working, and cross-learning can help the workforce avoid making their own mistakes as they learn from others. What have we achieved? And is it enough? Right now, we have much better policy and governance for the laboratory workforce than has existed across the past few decades. There is a global strategy for human resources for health that runs until 2030. We want a workforce that is able to meet the targets of Sustainable Development Goals. Unfortunately, Sustainable Development Goals cut across the other areas I mentioned: the animal health, good water supply, occupational health, gender. You cannot leave any of those behind. The WHO resolution on diagnostics was also adopted during the 76th World Health Assembly last year. And Africa CDC has a strong pillar, which is focusing on the public health workforce, which would most certainly cover the laboratory workforce. There are also other collaboratives, which actually give me hope for the laboratory workforce. For instance, there is a framework, which is a partnership between food and agriculture, which is including environmental programs, World Organization for Animal Health, and the WHO. These intend to coordinate the One Health approach because of the recognition that without a holistic approach to these challenges, you can actually not meet your targets for 2030. Human resource partnerships are critical. We have ASLM, which has actually been a strong force working concertedly to map the workforce, to provide some guidelines, and to train lots of professions across the continent. We have Africa CDC, we have AFENET, we have the Global Laboratory Leadership Program, we have the networking LabCoP, pardon me if there are more than 22 countries by now, but you also see that governance has been strengthened, particularly for the laboratory workforce, as depicted by the Laboratory Directors Forum, which was launched last year. We have a One Health collaborative, which has 9 countries and so many other groups coming together. What is important is the health laboratory cannot exist without partnerships with these other workforces or these other laboratories. So how do we need to move? In order to plan the workforce, we need to know who are the lab workforce we have in terms of skills, numbers, distribution, but we also need to know who do we need given the projections of diseases, non-communicable, foodborne, waterborne. What are the needs we have for the continent? And for the staff we already have, what are their competence needs? What skills building is needed for those staff we have? We also need a critical mass of engineers to avoid the wastage of equipment within the laboratories. What can be done to ensure that we have a workforce which is able to quickly and swiftly attend to the issues of equipment? Lately, there's been discussion about community laboratory workforce. How can the community be harnessed to actually bridge some of the gaps? For instance, using point-of-care diagnostics, how can they be used? So there is a need to map out the needs and what other workforce can be tapped into. At the end of the day, like I said, this workforce needs to cater to human, public health, environmental, animal, occupational, food in partnership. So as we focus on the human and public health, we also need to work very closely to ensure that the environmental are not lagging behind or working independently. The animal are not working independently, so that they are all aware of how their activities ultimately trickle down to the health sector and influence the workload of the human health laboratories. So there is also need to map the capacities of training institutions as we plan and we know what we have and what we need. What more is needed? Are the training institutions enough? What do they cover in terms of their curricula? What are their outputs? What is the licensing of this to ensure that you have a good product coming from these training institutions? We also need to look at the strategic plans for human resources for health. You will find that many strategic plans actually do not have a core focus on the laboratory workforce. So my bottom line here is there is a need for research to generate but also to push for the application of workforce data. This evidence will help to plan, because without planning, we would be dancing in the dark and just doing work without really knowing what we need, but you're driven by events. And I can give you an example. In many cases, for instance, when we had COVID, we had an avalanche of capacity building for COVID. We've had a lot of capacity building for TB tests, HIV tests, which is good because it builds the capacities for the lab in general. But when you look at that, are we neglecting other areas? Most likely we do. So we need to be more intentional as we plan the workforce and as we skill them to meet the needs of the 21st century. When you look at pre-service training, there are lots of challenges. And this does not cover everything. There is very limited research, but most African countries have increased their capacity to train. However, you will find that many of them are training you will find that only like 28 out of more than 65 or 65 are training nurses, but laboratory science, they're training fewer training institutions. There is also a shortage of qualified lecturers, specifically for laboratories in both public and private universities in Rwanda. In Uganda, the majority of training institutions only offer certificates and diplomas. We only have a few offering degrees. While in Kenya, which was performing a bit better, you'll find that 1 out of 3 registered training institutions are private. However, there are opportunities. There are opportunities to leverage on superior infrastructure via public-private partnerships. You will find in many of our countries, with a few exceptions, like South Africa, which have really evolved public sector laboratories and training institutions, you will find that many of the lower training institutions don't have the equipment enough to actually train this workforce to a level which is standard. So partnerships with private laboratories could actually open up these opportunities to train the workforce. I can give you an example. I work at the School of Public Health, but when we are training masters of public health, we usually take them to placements, and they will go to different districts, do some work there for about 2 months or 3, and they will also go to the Ministry of Health. So these kind of placements are critical. These are partnerships which help our students to gain the skills, and this would also be very vital for the laboratory workforce. Curriculum reviews. Some universities take a longer time to actually update their curricula, but you will agree with me that given the current state of affairs, many curricula for laboratory staff need to be upgraded. They need to fit the change in the environment in order to produce a workforce that is fit for purpose. What about developing the workforce? So you have the post-service training needs assessment. We need to know both technically what is needed, and in terms of catching up to technology, what do we need? How do we make a workforce which is up to speed with the way things are changing? We need to have a workforce with quality assured. You need to move from one lab to another with the confidence that the tests are standard. They need to have access to continuous professional development. And it would be good if this is self-driven, with virtual learning, but also some hands-on, like I said, with partnerships. Networking is good. I think LabCoP is a very good idea. The leadership and governance is critical to the development of the workforce. Multidisciplinarity has been a gap. The lab workforce cannot afford to work in isolation. There have been initiations of partnerships with, for instance, the veterinary, with the occupational health, so this is a very good thing, because then the lab workforce is moving as one towards the ultimate SDG goals. So partnerships are important, but also we need the expertise to deliver the highly specialized laboratory services. And of course, here I can share a personal story. I had the opportunity to take my child for a bone marrow transplant in India. And sadly, I had to send all the diagnostics to India. So if Africa is working towards self-sufficiency, these are things we need to comfortably be able to do. We need to decolonize this. We need to have laboratories which are able to deliver highly specialized laboratory services. We cannot afford, and I'm not speaking alone here, these laboratories actually service many countries in Africa. Nigerians send their samples to India. Everyone is sending samples. There are things that need to be done better for Africa, and the laboratory is center to this. To date, people are still sending samples of many things. So we need to do business a bit unusual to develop this highly specialized workforce to deliver on some of these services. What about managing the workforce? For managers out there, they have to deal with the change in their environment. They have to deal with the alternative models of service delivery in order to have efficient use. For instance, the use of hub laboratories or reference laboratories, they impact on what the manager on the ground is doing and how well they can use their workforce. Telemedicine would also impact. So would mobile laboratories. How do you manage that? How do you estimate what you need where and how often to actually send this out? Point of care tests, even self-testing. All these are affecting the way the manager actually is able to deliver on their tasks. I talked about task shifting. So if you have a community health workforce, who supervises these? What are their terms? And what are the relationships between the community health workforce, which is helping perhaps with some of these POCs? How do you actually even keep tabs on the quality of the tests? Performance management. We need to have within the policies revised cadres. We need to have redefinition of cadres. Revised job descriptions, revised staffing norms, because right now the environment has shifted and those old staffing and cadre definitions might not apply to the current challenges and opportunities for the lab workforce. I can't finish this without talking about incentives. You can't keep your workforce motivated without incentives. And this is a workforce which faces low salaries, poor career structures, grueling work environment, as well as gender and mental health issues. So all these are issues a manager has to look into. And the public health workforce, the manager of this workforce needs to be collaborative. They need to have critical thinking. They have to have very good communication skills. They have to be connected. And again, I reiterate on the importance of having laboratory director forum, laboratory community of practice. This is so important for the 21st century. Right now, a lot hinges on connectiveness, collaboration, communication. Any manager who cannot do that is actually failing for the 21st century. So managers out there, you need to hook in. I tend to think that this is a chance for us to move from ad hoc, piecemeal, short-term investments, which have not worked and will not fundamentally solve these workforce shortages, and I must say excesses and challenges. Sometimes we tend to think of only workforce shortages, yet in many countries, they are also dealing with workforce excesses because of the inability of the system to recruit the workforce it trains. And that shows a mismatch between what we are training and what we need, what the market is demanding. So there is need to have this talk, okay? So the key messages from my talk, and I hope I'm still in time, is that there is need to map the workforce. But we also need to know what we have, what we need, what is the training capacity within the countries, what are the skills we have, what skills could be built up, how are they distributed, how mobile are they, what is the attrition, who are the health workers who are moving from the health sector into farming. We have those. We need to know what are the capacity building efforts and how can we cross-fertilize health services with environment, climate, and a One Health approach. How can we bring them together so that their thinking, it might not be similar, but the mindset is that what happens in the environment, what happens in the animal, ultimately trickles down to the health. This health workforce needs to have both hard skills. They have to have technical skills which are up to par. They also have to have IT skills because of the rapidly evolving environment. They also have to have the soft skills of leadership, agency, and networking. I already mentioned that without collaboration, without communication, without critical thinking, we don't have a workforce that is strong enough. So we need a management building management skills which can help to harness the new opportunities we have for service delivery. Performance management is important, but that will not happen without clearly defined cadres as well as job descriptions which fit the current status. Quality assurance will enable health workforce to be trained who can move across borders and confidently work in Eritrea, confidently work in South Africa if need be. That is important for this laboratory workforce. On top of it all, you need a supportive environment, workplace policies. What is the pipeline? What is the career path for this workforce? I already mentioned that partnerships are critical. These partnerships could be partnerships who fund, they could be partnerships who have equipment or infrastructure which can help to train. They could be partnerships which help to share, to foster joint learning. It's important. And last but not least on this is the research. We need good research on the laboratory workforce. Very good research, which will inform the decision making. Thank you very much.
Thank you very much, Dr. Susan. What a presentation, and very insightful. Did you say in the beginning that this touches us and this is ours and this is about us as the people who work in the healthcare service delivery? I noted a few things here and there, but I just want to highlight a few things. The fact that the lab is very well structured when it comes to the work it is supposed to do, the roles and responsibilities, the way they do their things, their procedures are very well structured. But it is interesting to note that when it comes to financing, then things begin getting gray. When it comes to understanding who is where, we do not have hard facts, no data, not a lot of research done there. I thought those were very, very insightful pieces that came through this. Also, for us to move on in improving the lab workforce and general healthcare workforce, we need to know what we need, where, in terms of numbers, in terms of the skill set that should be available, and not forgetting that the environment in which we work really should shape our thinking in terms of skills and knowledge development. Because if the environment is changing and for us, we are not changing, did you say that is the same as those who are dancing, and the tone has changed, but the steps are not changing, and you'll totally be out of place. So I very, very insightful. As you take your breath, you really ran us through very well. We have some quick questions and comments that are coming through, and I'll encourage colleagues to continue keeping our chat buzzing so that we can deal with some of those comments, but also some of the counter comments that are coming through are very helpful. I will just take one comment that came in from, it's a question from Bernard Waimi, and Bernard is asking, you spoke about the incentives to the public sector, and I guess it goes to the other sectors as well. But what would be your advice to the ministries of health and finance out there in terms of provision of incentives to the health workforce to keep them motivated and doing what they're supposed to be doing?
Thank you very much, Francis. You see, the advocacy for the lab workforce has not been strong. Like I said, these are a workforce who work behind the scenes. When doctors order a chain of tests, they receive results, okay? But the extent of the work going on behind the scenes is really underappreciated, okay? So you will find a flood of tests from all departments, for instance, in a major hospital. And all these are headed to the laboratory. And then the doctors use these results, okay? But when we estimate the lab workforce, the workforce we need, we usually do it on the basis of, it's only lately that it has changed. We've historically done it on the basis of how many doctors do we need by 1,000 population, how many nurses and how many midwives. There have been very few countries which actually can say, okay, if so, then how many lab workers do we need? It's just lately that some statistics are coming out, but even those statistics vary because the laboratory workforce is equally diverse. The laboratory workforce has pathologists, it has imaging crew, it has the microbiologists, it has a diversity. Now that you have the Directors Forum, this Directors Forum is a powerful force for advocacy, a powerful force to bring this critical need to the forefront for the ministries of health. When I was at ASLM, we were privileged to have Uganda's Ministry of Health. The minister herself attended, which shows a good direction. But we need to bring on board more ministers of health to appreciate the work which goes on behind the scenes for the laboratory workforce. When we did research in Uganda, one of the most disheartening things we saw for the laboratory workforce is that we had very few pathologists, meaning that the turnaround time for, these are by pathologists, I mean for anatomy, for tissue, the slides which are taken for cancer, and very few. We actually had around 2 or 3 in the country, meaning that these samples are taken and posted, and then the patient who has cancer has to wait ages before their results come out. This is not good, but we need a profile to be raised. We need an advocacy voice for the workforce to bring this workforce to the forefront in terms of need. If we are having an increase in non-communicable diseases, we need to be able to test that. I don't know if I've answered your question. I think we are building on the leadership and the advocacy. And what I can say to the ministries of health, perhaps first to the directors, these laboratory directors across the countries need to come together and actually voice the need for better laboratory practice within their countries. Very important.
Thank you. Thank you very much, Dr. Suzanne. Really, really very comprehensive response. I have one other comment. This is from Misek is asking, and this draws from the fact that the knowledge and skills should be changing with the changing environment around the delivery of laboratory services alongside the general healthcare services delivery. But we know that the development of that skill and knowledge is shaped at training institutions, universities, training colleges, among others. And you're from one of the prestigious universities on the continent. His comment is on the difficulty in registering training institutions. And I think this should be inferring to private training institutions. Do you have some experience that you would want to share in terms of registering training institutions that can then support the shaping of the workforce that we're looking for to support the delivery of lab services in the 21st century?
I can't speak to other countries. I can only give examples of what happens in my country. And in my country, Uganda, you actually need to get accredited. That is because the standards have to be the same. These are people's lives which we are dealing with. So not any institution can get licensed to be a training institution. And they need to go through that rigor in order to qualify to be a training institution. Because personally, you wouldn't want to know that your laboratory provider came from some mushroom institution somewhere. So oftentimes the difficulty in registering institutions stems from that fact. Does this training institution have the capacity to deliver on what it is promising to do, or is it just trying to fleece the public? So those are some of the problems, and that is what the gatekeepers or the regulators deal with before they can allow an institution to become a training institution. Now, I might not know for other countries, but the other thing I know which affects that is this training institution providing anything different from what others are providing? So there are a number of parameters which come into play. Is the training institution providing services in an hard to reach area where they would need to train that cadre? So those are the considerations to ensure that the market is also served by this training institution. I don't know whether that answers, but I'm giving examples based on my own qualification, based on my own country and experience. Over.
Perfect. And I know that you keep saying that you can only infer your findings for as far as the data allows. And so the data that is available to you can only allow you to infer whatever it is that you're suggesting or sharing based on what actually you know and appreciate very well. And thank you very much again for sharing with us the Uganda experience. I have, we're running low on time, and I know it has been you and you alone taking us through the entire 1 hour. You might need to take a breather at some point, but we have a few comments, and some of them are really, really worth reading, but if we don't get time, we'll not take all. The one that I will take us through is from Babatunde from Nigeria, and this is saying that, thank you, Dr. Susan, for the thoughtful and provoking presentation. It is disheartening that some of the laboratory services are deteriorating due to maintenance culture. And I don't know if this maintenance culture relates only to human resource, because we know there are also issues of attrition that really affects the quality of services if the skillful, trained, experienced people continuously move on to leave space for very inexperienced people to take on tasks that probably they wouldn't be able to do. But his comments goes on to say, and I think it ends with a question: how can we deal with this challenge of maintenance? And I'm still relating it to maintaining the human resource and trying to protect them from attrition.
How can we maintain the human resource? There are lots of things that contribute to keeping a health workforce committed. And sometimes you might find that salaries are a good starting point, providing training, recognition. But at the end of it all, every health worker needs to have a career track. They need to be able to have the ability to move from one level to the other. In a system which offers little or no opportunity for that, it can be very challenging to motivate. So the health workers, the laboratories, health workers need to have opportunities to grow perhaps into management positions, or even technically to advance either through training or through broad experience within their system. So there is need to have a kind of career ladder for this health workforce to keep them motivated. I can say that in some areas, people stay in their workplace because of the chance of being promoted. Over to you.
Thank you, and thank you very much, Suzanne. I think the last comment we'll deal with is on and I think the question came in when you hadn't dealt with the aspect of staffing norms. But Dr. Collins Otieno was asking if, in your opinion, there should be regular reviews of the staffing norm that then defines the skill set, the numbers that should be deployed at the different levels of the lab tiers, health centers, general hospitals. And of course, the complexity of testing increases and the skills that are required changes across those tiers. But his question is, in your opinion, would you then recommend that the norms, the staffing norms, are changed quite routinely to try and match the needs? But not only the norms that are set, but then the set norms are also met, because sometimes you have a norm that is set and only 40% of that is actually being met in some settings. Your comment on that as the final comment on the questions that have come through.
I think that is a very important question, given the fact that in most of our countries, we have different tiers of service delivery, and those demand different levels of skills for the lab workforce. However, I think we still also need to improve on the way we distribute on the staffing norms for the highly skilled. So you will find some high-level hospitals are not even able to attract those specialized people. Setting the norms is a starting point. And if those highly specialized centers are serving a broad area, then norms which accommodate that population needs to be brought to bear. Now, I know that I'll just use this cliche statement. A journey of 1,000 miles starts with one step. Setting those norms and being aware, for instance, that we need pathologists all over the country in different, these are anatomy pathologists and others, of course. We need imaging specialists all over the country. Who do we need if they are serving a big population? How many do we need? Having those norms set is a good starting point for any country. Now, once you have those norms, then you have a basis to pressure the governments and the leaders to fulfill it. But if you do not have the norms, you don't even have the basis. So what I would say is that the important first or starting step is to figure out what do we need where. And it's good that we all have these reference laboratories. Is it good enough? Is the turnaround time for the different tests acceptable? Are there areas where we are still performing dismally? Could we improve? That is an indicator of where you need more workforce or more resources or a better system in order to meet our targets. So in answer to your question, the first step is establishing those norms. And then the next step is advocacy to ensure that we actually meet those norms or implement them. Thank you very much.
Thank you. Thank you very much, Dr. Suzanne. And surely it has been a very insightful session. And just to colleagues who are here, we know we have lab practitioners on here, we have managers, we have agencies that support countries to implement lab services. And it is really key, and it is quite key that beyond the technical skills that the lab people should be having, we need to have procurement skills, we need to have management and leadership skills, we need to have these other additional skills to be able to respond to the needs of lab services delivery during this new era that really does not allow us to only focus on technical service delivery. Otherwise, you'll ask for a biosafety cabinet, and because the procurement person does not get all the details right, they will get you something else and they will call it a safety cabinet. So as we come to the end, allow me just make a few announcements. The session slides will be shared with us through our social media platforms, and also the recording will be made available once it is processed. For those that need to get copies of their certificates for this attendance, please, the certificate code is available currently on the screen. Pick that out and be able to access your certificates.